Hello, welcome to another edition. Now you're seeing me in a scrub because I'm talking as a medical doctor today, not as a life coach, which we have done over the last month. My name is Ahmed Abdul Karim. I'm a medical doctor and a life coach with over 10 years of experience. Now we want to shift chair and talk about health. And I've thought about it. There's no better way to talk about health than to talk about mental health. Mental health has a very huge burden. A lot of undiagnosed mental health conditions that usually graduate into severe mental health issues. So I thought, why don't I educate the masses about mental health and equip you with strategies to deal with this condition. So what is mental health? When we say mental health, what exactly do we mean by mental health? So mental health refers to our emotional, psychological, and social well-being. It affects how we feel, how we think, and how we behave. And if you look at this critically, you see it is fundamental. Something that affects how we feel, how we think, and how we behave should not be taken lightly. Let me give you an instance. There was a man who I was attending to, and I was called to come and see because it became chaotic. They couldn't control him again. What happened? He wanted something. Let's say he wanted biscuit, for example, and they've given him biscuit, and then as he was getting it, said, "Can I have a cup of tea?" And someone said, "Oh, can you please sit down, and while you have the biscuit, I'll make a cup of tea for you." Do you know what he heard? What he told me he heard? He said he was being talking to in a condescending manner. How can you tell me, like, go and sit down there, you beggar? That is what he interpreted in his mind. So you can see how we think, goes a long way, and this is because of his background mental health issue. And this underscores, knowing who you are dealing with, because having this information about mental health also helps you to be able to deal with different individuals, because you have to understand where they're coming from. It doesn't have anything against this, but it was very chaotic. It took my intervention to settle things. So the only thing he heard was he was being told to go and sit down. Just go and sit down there, eat your biscuits, and then I will sort your tea for you. But the other person kindly said, "Can you please have a seat? You can continue to have your biscuit while I make a cup of tea for you." That's all. And then I had to explain to him this very simplistic term, and he understood it. And then he apologized. This is a very simple case, but iterating the importance of mental health, because once something tweaks, the way we see things, completely changes. So our interaction with the world, our interaction with every other person, our interaction, the way we enjoy our relationship with family, our work, our school activities, depends on our mental health. And it cannot be overemphasized, the importance of mental health conditions and mental health well-being. So what are the different kinds of mental health? When we say mental health, it's not just a blanket word. There are several things that comes under mental health conditions, and I'm not going to be exhausting everything today, but I'll be listing a few for you. One is mood disorder. So it's one of the most common mood disorder, and this includes depression, which you would have heard of multiple times, that somebody is depressed. Again, I'm going to make a separate video about depression. What exactly is depression? What are the signs and symptoms of depression? What should you do? I'm going to make a separate video about depression, hopefully my next video. There's also anxiety. There's bipolar affective disorder, in which the person alternates between high and low mood. Okay, and there are treatments for this. Apart from mood disorder, we've also got psychotic disorder, which schizophrenia is a major example of that. The perception is just different. People see things that are not there. They hear things that are not there. They have erratic behaviors. So that's another one. And we've also got trauma-related, like people with post-traumatic stress disorder. That's another very common one. And I think I should make a video about post-traumatic stress, because some people have PTSD without actually knowing that they've got it. PTSD is post-traumatic stress disorder. There's personality disorder, which is very important as well. There are several people that, when you deal with them, you realize that they have got some sort of personality disorder. Some people can cope with it. Some people is becoming maladaptive and they need to seek help. So, and oftentimes people with personality disorder do not know. So it requires somebody that is close to them to have the knowledge and be able to get them help. Examples include narcissistic personality disorder, histrionic personality disorder, borderline personality disorder. So these are the various types of personality disorder, among others. This is not like the list is not exhaustive, and we also have phobia. You might have had people afraid of insects, afraid of heights, afraid of closed places, claustrophobia, arachnophobia, and several other phobias that phobic disorder that are there. So this is just a few examples of the different things that can go wrong in how we feel, how we think, and how we see things, that could be regarded as mental health conditions. Now, what could predispose someone to having mental health conditions, the various type of mental health conditions? Why would I or anyone have mental health condition? What are the risk factors, to put it? One is biological factor, okay, because some people are naturally predisposed, and these people, they need to know that they're naturally predisposed, and they need to then do things that reduce their risk, which I will mention later on in the video. Like for instance, you have family history of somebody with a diagnosed mental health disorder, any kind, your risk is increased. Also, the way the brain of some people is wired also predispose them. It makes them see things differently, like ADHD, attention deficit hyperactivity disorder, especially in children and some young adults. Autism, autism not necessarily a mental health disorder, and then that's not biological history, okay, but biological factor that can predispose someone to it. Then the social and environmental factor, so where you live, the social network that you've got. Have you got help? Have you got friends, family? What do you relate with? These things also help a lot. Imagine a young man that live in a neighborhood where everything that happened there is drugs, and that is all that he knows. In fact, I had someone who, when I was talking to him, he was wondering why his mom was so worried about his drug habits, because he told me everybody takes drugs. You can imagine, everybody takes drugs, because that is the reality. That is what he knows. So this again underscores the importance of environment. Socioeconomic factors like poverty, illiteracy, unemployment are also risk factors for these things. Apart from that, we also have psychological factors like the trauma. So people that have been victims of trauma as a child, either rape, assaults, abuse of any kind, it's increased accidents. If being involved in road traffic accident, either involving loss of life or not, people that have been to war or witnessed war or even walked in the war zone, increases the risk of mental health, especially the post-traumatic stress disorder, which can increase the risk of other forms of mental health disorder. So that's another major factor, stress in life. So we've talked about then lifestyle. Lifestyle is another thing. Sleep, nutrition, exercise. So lifestyle is a major. If you are sleep deprived, if you don't eat proper diet, if you live sedentary lifestyles, this increase your risk of developing any form of mental health disorders. Other factors include medication. So some prescribed medications can increase your risk. Your medical conditions. Some people, when they are diagnosed with chronic medical conditions, like cancer, like COPD, like any other form of chronic medical condition, heart failure, predispose them to some form of mental condition, which is understandable because they think this is how they will live the rest of their life. And substance abuse is a major. That there are some mental conditions that are particularly, even any of these medical conditions could be substance abuse related, cocaine, heroin, cannabis, and this underscores the importance of avoiding these things. Avoiding this is very, very important. So that's another risk factors. So among others, now we've known what could predispose one to developing any of these mental conditions that we have mentioned earlier on. Now, what can you do? Either to reduce your risk or to prevent, or no, not prevent now, either to reduce the risk, which is prevention, or to treat yourself, among others. One, if you have any symptoms that is related to any of this information, please seek the help of a professional mental health practitioner or a doctor who can refer you appropriately. But things that you can do on your own are what I'll be mentioning now. One is self-care. It's important to prioritize your self-care. You sleep appropriately and adequately, exercise. Exercise again. I think I will make a separate video about exercise because we misconstrue this a lot. Okay, so sleep, exercise, diets, balanced diets is very important, and then also relaxation technique. If you practice meditation, yoga, these things, the self-help techniques matters a lot, and they improve our ability to cope with stress of life and improve our mental health. Then social connection. You need to build relationship. We need to build relationship with the right set of people. Okay, know your friends, treat your friend appropriately, and build relationship. Visit the families and friends. These things helps to improve our overall wellness and mental health. Also, stress management. When we say stress management, one, you need to be able to identify stressors. You need to know what stresses you, and that's only when you'll be able to then avoid the stresses. So avoid the stresses and then manage the stresses. So identifying stressor is a very important aspect of managing stress. Also, you need to be able to setting boundaries, because oftentimes people that take on a lot of things than they can cope with, because they don't want to offend some people, or because they just want to exercise the strength or their capability. They often burn out, and this can predispose them to having some mental health conditions. Also, take breaks. Break whenever you feel like you're burning out. I have a friend now who realized that his productivity was already declining. Just took a few weeks of annual leave to recharge, to rest, to connect with friends and family, and then got back to work. And there's a boost in the productivity. This has been proven to work. So taking break when needed is very, very important. And even during a day's work, not necessarily taking annual leave. During a day's work, when you realize that your productivity is rising, your energy level is rising, just take a free break, get some fresh air, and you would be surprised how much this can do to you. Mental health practices like mindfulness. Mindfulness, again, it's about being present in the moment. You understand? It's different from meditation. Mindfulness is whatever you are being mindful, you are present, you recognize how you feel, how you think, you recognize what could be causing it, and then you're taking immediate action to mitigate it and to align with whom you want to be, not necessarily what the mood is dictating. And then also getting involved in activities that you enjoy and seeking professional help. Those are the different kind of mental health practices that can be very important in mitigating different mental health conditions. Also, we need to again emphasize self-compassion, self-love, self-care. These things, they're not just buzzwords. They are things that we need to prioritize. Most importantly, seek help, please. Seek help when you or someone you know or someone you love or someone close to you is suffering from anything that you feel is quite abnormal. There's a lot of stigma around mental health condition in our society, and it is important to point out. Please, when you see somebody, struggling with this is out of their volition. We need to give them the help that they need, and there are professionals that are trained to treat symptoms and conditions like this. Please let us give them the enormous support that they need and give them the help that would get them back on the track, because this is the only way we can win the war and the struggle against mental health condition. We need to together fight the stigma, because just like any other physical health condition, mental health is usually not the volition, except a few, like those that are caused by substance abuse. Even that, when you do the root cause analysis, you realize that you might not necessarily be able to point the finger to the individual. So if there's something I want you to take away, one is be aware of the various kind of mental health condition, what could predispose you to it, and what are the things you can do to reduce your risk. Be aware not only for yourself but for other people that are around you, and compassionate towards them and give them the help that they might need, and hopefully we'll have a healthier and more robust environment and society. Thank you very much, and enjoy the week.